Hi, everyone. Welcome to another episode of the Humans of Medicine show. Today, we're going to talk to Dr. Bhavana Girish, who is a OBGYN and a fertility expert. She also has her fellowship in reproductive medicine. In this episode, we're going to talk all about fertility preservation, egg freezing, embryo freezing, and so much more. Hi, Dr. Bhavna. Welcome to the Humans of Medicine show. And how are you doing?
I'm good, Nishant. Thank you.
So let's get started.
Sure.
What is fertility preservation and who needs it?
So, fertility preservation, basically, as the name says, is putting a clock on your fertility and freezing your eggs or your sperms so that you can use these later in life when you may not be able to get pregnant naturally. So, the concept arose especially in women because women are born with all the eggs that we will ever have in our lives, which run into a few millions at birth. Then, by the time you hit puberty, these are in tens of thousands. In your reproductive ages, which are probably your 20s and your 30s, you're still in those tens of thousands.
Right.
But by the time you hit 40 and above, these become very few, like 1,000 or lesser than that. And 1,000 eggs does not always mean 1,000 pregnancies. The number does not indicate the quality. So
Right.
even as the age declines, the quality also is going to start to decline. So your peak fertility is actually in your 20s and 30s. And this is when fertility preservation is an option for you.
Right. So, what is the optimum age for egg freezing?
So the right age to freeze your eggs, like I said, biologically, as per your biological clock, would probably be your 20s and early 30s. But that doesn't mean that egg freezing is not an option if you've crossed this window. Looking at your ovarian reserve and your other parameters, your doctor may be able to tell you if you're a good candidate whenever you choose to do it. I have, in fact, frozen eggs for some of my patients who were in their late 30s as well. But of course, the outcomes, the chances of having a healthy pregnancy does go on declining the longer you wait.
So, ovarian parameters, like what are the tests that are required to evaluate these egg freezing processes?
So the most important tests, these are also called as the tests of your ovarian reserve. This is basically an ultrasound plus some blood tests that we do. The ultrasound is done ideally between the second to the fifth day of your periods. It is to assess your antral follicle count. Now, to understand simply what are the antral follicles, when we do a vaginal scan, we look at your ovaries, we see the number of eggs which are seen on the surface of the ovary. These are the antral follicles, or these are the eggs which have the potential to grow and be released in that particular month of your menstrual cycle. Every month, there are more eggs in the center which come to the surface between the second to fifth day. So this is the ideal time at which we assess this. The assessment is done by a vaginal scan, which is not a painful procedure at all. It takes hardly 5 or 10 minutes. We actually count the number of eggs in each ovary, which needs to be about 5 or 6 per ovary. That is what we deem as an optimal egg reserve. Anytime if this is reduced, the number of eggs we have to harvest is of course reduced. If it is on the higher side, that means you may be suffering from PCOD or PCOS. The second most important test that we do is a blood test called as the AMH, or the anti-Mullerian hormone.
Right.
What anti-Mullerian hormone does in the fetal life, its function is to prevent the development of Mullerian structure. So it's more in the boy fetus. But in an adult woman, this is a hormone secreted by the preantral and the antral follicles. So it again tells us about the number of the antral follicles as well as the functionality of these follicles. It gives us an indirect assessment of the quality of the eggs as well. The normal or the optimum response is obtained when the AMH levels are between 2 to 5 nanograms. If it's on the higher side, it could suggest again PCOD or PCOS. Between 1 to 2 means that your ovarian reserve is on the decline, and this would be the time when you should seriously consider egg freezing if you're not planning to have a child in the next year or so. Below the level of 1 nanogram per ml is when IVF becomes more or less a necessity.
So, based on your egg count, follicle size, as well as AMH levels, what is its impact or significance with the process of egg freezing itself?
So, AMH and the antral follicle count, or the AFC as we call it, gives us an indication of the number of eggs we are likely to get. And for a lot of women who are unsure of their plans, it also tells me about how much time they have remaining on their biological clock to plan for a pregnancy. So, most of the time, women come to us about just wanting to know what is their fertility potential. We go ahead with these tests, we look at the numbers. More or less, we can give an assessment of, say, you have 2 years, 3 years, 5 years left on the clock. There's no worry. If it's on the lower side, or if you are absolutely unsure of your plans, go ahead and freeze your eggs. Because there are people who are married, but they're like, okay, we want to postpone our childbearing for about 2 or 3 years or so, or who are about to get married or have a partner in mind. But there are also women who are like, I have no idea how things are going to go in the future. In that case, egg freezing is the right option for you.
So, what is the duration for this entire process of egg freezing?
So the process by itself takes about 15 days. What we do is we start giving her the hormonal injections starting from the second or third day of the periods. The intention of giving these injections is to grow as many eggs as possible. Left alone, the ovary is capable of releasing one or maybe maximum two eggs at a time. But when we are trying to do egg freezing, we want to harvest as many eggs as we can in that cycle so we have more numbers for the future. So we give injections to stimulate the ovaries to release as many eggs as it can, 5, 10, 15, depending on its capacity. We'll be scanning her in the middle of this 10 to 15 day period to see how the eggs are growing. Every 2 days or every 3 days, she'll need to come into the office for a scan. Once the eggs reach a mature size of about 18 to 20 millimeters, we give an injection for the final maturation and we do the oocyte retrieval or the egg pickup process. Once the egg pickup is done, they are frozen for future use.
So, now that we know the process of egg freezing, how does a woman prepare her body for the process itself?
So once she has decided that she wants to go through this process, maybe a month or 2 months prior, she will need to visit her gynecologist and fertility specialist who can do her routine blood work, make sure that she's not suffering from any other conditions like thyroid or blood sugars or a low hemoglobin or vitamin D deficiency, screen for all of these and optimize them. And then she may be started on certain medications like folic acid, medications to improve the egg quality, thyroid medications if necessary. Certain lifestyle changes she'll be encouraged to do is to stop smoking immediately, to reduce the alcohol intake to maybe once in 2 weeks or once in a month, stop any form of drug usage, review her medications if she's taking any in the past and may need to change the dosages or stop any medications which are unsafe in pregnancy. And after all this, we can schedule the procedure for the next cycle. Once she gets her periods, she'll be coming down on the second or third day of the periods and we'll be starting off the procedure.
So, what are the hormonal injections that a woman has to administer, whether she can administer herself, and what is the route of administration? Can you just elaborate on that?
So the common hormonal injections which are used are basically recombinant follicle stimulating hormone or FSH and HMG or human menopausal gonadotropin. Both of these are very in liquid form, very painless injections, and these are administered subcutaneously. A lot of my patients can administer this themselves at home. Some of them who are not comfortable with doing it by themselves may need to come into the clinic and our nursing staff can administer it to them. These are like insulin shots that diabetic patients take. So they are given in the thigh, can very easily be taken by the patient themselves and are more or less pain-free.
So, can you walk us through the common side effects of injections? And second thing is, how can the daily activity, whether can it be restricted or whether it can be continued?
The injections as such don't have any major side effects. Any side effects are generally limited to the duration of the injections, be it the 10, 12 days that they are taking it. Most commonly, they can have injection site redness, pain, a little bit of swelling. All they have to do is apply an ice pack on it. Some hormonal side effects like a little bit of breast tenderness, bloating, nausea. Again, these go away completely after the next period. With regard to the daily activities, they can carry out all their routine work including office, household chores, all of these things, they will be advised to abstain from sexual activity for those 10 or 15 days. Exercise can be continued,
Right.
excepting strength training, high intensity training, and something which involves lifting a lot of heavy weights. Apart from this, they're good to do everything.
So, are there any dietary restrictions during or before the egg retrieval procedure?
So, no specific restrictions as such. Healthy home cooked meals on time as much as possible. Avoidance of alcohol is a must during the procedure and any other drugs. Good intake of water and a high protein diet as much as possible, especially egg whites, legumes, all of these things are better to consume. And drinking plenty of fluids, because this does put you at a higher risk of urinary infections during the procedure again. So 2 to 2.5 liters per day.
So, is this procedure painful? That's a common question that you must be getting.
So, egg retrieval is not a painful procedure. It is done under anesthesia, which is generally an IV sedation anesthesia. It is through the veins, no tube in the mouth or no spinal anesthesia. The duration of the procedure is about 15 to 20 minutes at max. The duration of the hospital stay is going to be about 4 to 6 hours. So, that one day would have to probably be a leave from work. Most of the times, my patients are good to go back to work the very next day or maybe one day after that. A little bit of the anesthetic side effects in terms of a little wooziness, drowsiness, sometimes a little constipation or bowel issues may last for about 24 to 48 hours. But after that, they are absolutely back to normal. The hormonal side effects may last up to a week or 10 days. Once they get their next periods, again, they're absolutely back to normal.
So, this is basically a daycare procedure.
Absolutely. The patient may have a little bit of vaginal soreness or discomfort after the procedure, but again, nothing that lasts for more than 12 to 24 hours.
And how long does it take to continue an activity after this?
She can get back to her exercise routine even about 24 to 48 hours after the procedure.
How many eggs are retrieved in a single cycle of egg retrieval procedure?
Our target is to retrieve as many as we can. The better the number, the more the chances of us forming healthy embryos in the future. We can give the patient a relative assessment of how many we can probably get by looking at her AMH and her antral follicle count.
Right.
An ideal number, depending on her age, would be something in the range of about 10 to 15. So for the best result, there is actually a lovely calculator that I use by a doctor called Dr. Lucky Seacon, who has a blog called The Lucky Egg. And based on the age, it has an algorithm which predicts what is the best number of eggs to be retrieved.
That's interesting.
But of course, this is a Western data study. Between the ages of, I would say, 30 to 35, about 15 eggs would be a fair number. Above the age of 35, I think about 8 to 10 would be a fair number. And above the age of 48, the best we can get is about 5 to 6.
Okay. So how many cycles should one undergo to get those best amount of egg qualities or egg numbers?
I think as many as is required, So at the end of the day, you're doing this with the intention of having a healthy baby. So if that means, at the first attempt, you're not getting a good number or the quality is not great, mentally prepare yourself that you may need a second cycle. Usually, this is again something I talk to my patients about, looking at their AMH values. If I see that the AMH is on the lower side, below 1, I give them the honest impression that maybe you may need 2 cycles, or sometimes with an AMH of less than 0.5, maybe about 3 cycles for us to get the adequate number of eggs that it takes.
So one of the factors is AMH. Any other deciding factors?
The age. The most important predictor of female fertility is the age.
So when a person has to go for the next egg retrieval process, what is the gap or time frame that you would suggest?
In fact, we can go in 2 consecutive cycles. So the second day of this period, we start off the procedure. We do the retrieval. She's going to get her period in, say, about a week or 10 days time. From the second day of that period, we again go ahead with the procedure. A lot of times, patients themselves want to take a break of a month or so because they want the hormonal effects to wear off, which is fair enough. But I wouldn't suggest spreading it out over more than 3 or 4 months.
Right. And what about the periods or the menstrual cycle coming back to normal?
It'll come back to normal right immediately. So once the retrieval is done, most of the patients will get a period within about 10 to 15 days at max. The very next cycle may come a little earlier in my experience, but generally the cycle resets itself from the very next month onwards.
Right. And any further chances of dysmenorrhea or irregular periods in future?
Absolutely not. So the cycle which comes immediately after the retrieval may be a little heavier and a little longer than usual, but the cycles thereafter are usually back to the normal pattern.
So let's talk about embryo freezing now. And how would you differentiate between egg freezing and embryo freezing?
So egg freezing is done for single women or women who don't have a stable partner, or in which we just harvest the eggs and we freeze the eggs.
Right.
These are the unfertilized single gamete, that is the oocyte. In embryo freezing, we are freezing a fertilized embryo, which has both 50% egg as well as 50% sperm parameters. Now, if a woman is married or has a stable partner, I would always suggest freezing the embryos rather than the eggs, because the embryo is a multicellular structure. It is a much more robust organism. So it survives the freezing and thawing process with success rates of about 90 to 95%. Whereas with eggs, they are a single cell structure. They are much more delicate. So you do have losses when you are freezing and then taking them out of the ice. About 60 to 70% is the survival rate at my lab and generally data across the world. But there are 30-40% of those eggs which are not surviving the thaw process, and we are losing out on very precious eggs. So embryo freezing, if a stable partner, you're sure that you're going to have a child with this person, that is always recommended.
Right. So we spoke a lot on the tests that women need to evaluate before this. Let's talk about the tests that men as a male partner requires or needs to evaluate on this. Are there anything like that?
Singular most important test for the male partner is a semen analysis. We ideally do it with an abstinence period of about 2 to 5 days. This tells us about the sperm count, the number of sperms that are there, the motility, the morphology, how the structure of the sperm is. For older men or men who have certain risk factors like smokers, diabetics, we may choose to do an additional test to check for the DNA damage in the sperm. This is called as the sperm DFI, or the DNA fragmentation index. Any issues found with any of these may be treated with hormonal medications, or generally we put them on supplements like antioxidants, multivitamins, mineral supplements, and this also helps.
So just like how there is a biological clock for women, is there a biological clock for men? And if so, then what is the age?
The biological clock for men has not been very clearly defined. The society has not been, they're much kinder to men that way. And men are capable of having healthy children even in their 50s and 60s and above, as we have seen. Though there is an age-related decline, it is not as significant as it is for women. For women, we say above 30 is when the decline starts. For men, it's more around the age of about 40 to 45. But even then, the numbers are still good enough to produce a pregnancy.
Does it affect the sperm quality or the motility?
So quality definitely gets affected. The volume of the semen gets reduced, as well as the DNA damage that I talked about. Morphology reduces and motility reduces. But these are generally treatable as well. So for men, they have the ability to produce fresh sperm even into their late life, like I said, 70s or 80s. So a course of treatment can produce very good results within about 3 or 4 months.
And just like how there is egg freezing, is there a cryopreservation for men in terms of sperm freezing or banking?
So for sperm freezing, most men don't opt for it because they also know that, we can take our chances. The few men who come forward for this are men who are undergoing any sort of treatment which can damage their testicular tissue or damage their sperms. Right. Specifically, this is very commonly recommended in men suffering from any sort of malignancy. Blood cancers, testicular cancers, anybody who's due to undergo chemotherapy, radiotherapy, or people with autoimmune conditions who are on drugs which are known to affect the sperm quality. Their primary care doctors generally refer them to us for sperm freezing so that they can preserve their fertility, because a lot of these treatments produce irreversible damage to the testes, and then it would be too late.
So just to give an edge to our imagination, so how are eggs or embryos frozen? How long are they frozen? And where are they stored?
So the process of freezing of eggs and embryos is called vitrification. They are basically put in liquid nitrogen where they are stored at very low temperatures. You have these tiny straws called as cryolocks. The embryo or the egg is inserted into that. One straw can contain only about 2 or 3 embryos, but eggs they can contain maybe about 4 or 5. Once it is inserted in that and frozen, that is then put in liquid nitrogen tanks labeled with the ID of the patient, and then it is also connected to the system. And then that tank is kept in storage. So all IVF clinics have multiple tanks where there is a register as well as a computer system tells us which patient's embryo is in which tank.
You're right. And say once the patient has frozen her eggs and now plans on getting pregnant, so what is her next step going to be?
So eggs can be frozen as long as the patient wants. A year, 5 years, 10 years. Recently, there was a report which talked about a baby being born from eggs which were frozen almost 20 years in the past. So they will not deteriorate in quality as long as they are frozen. Once the woman plans for a pregnancy, she comes to us with her intended partner. Yes. We take the semen sample from the husband. We inseminate or we inject each of these eggs with a sperm after thawing them. We let that embryo grow in the lab, and then that embryo is then transferred back into her uterus where it implants and grows into a pregnancy.
So there's a common myth or misconception a lot of women or general population as such has, is that these frozen embryos, babies out of these frozen embryos are, or eggs per se, are they healthy?
Definitely, once something is frozen, I give the analogy of when you have frozen vegetables. As long as they're in the ice, as long as they're in the fridge, they're not going to deteriorate. Whatever deterioration happens is only once you take them out and you cook them. Right. The same way, these eggs and embryos are going to remain in their good condition as long as they are frozen. Once we thaw them, the poor quality ones do tend to deteriorate or not survive. That is why the survival rate of a frozen embryo is about 90% and a frozen egg is about 60 to 70%. Yep. The remaining poor quality ones just deteriorate then and there. If we are successful in getting a pregnancy from the survived ones, that is a normal baby. There is absolutely no abnormality because of the freeze-thaw process.
Okay, what is the cost of cryopreservation in India?
So the overall cost of the process is about 2 to 2.5 lakhs. This includes the stimulation, the injections which are given, the egg retrieval, and an initial freezing, which is usually for a period of about 1 year. If you wish to extend the freezing, you'll have to pay annual charges of about 20 to 25,000 per year, and that can be extended as long as you wish.
And what happens to the eggs and the embryos that haven't been used?
In India, thankfully, we have a law which allows us to discuss with the patient and have a shared decision making about what can be done with these embryos. So we discuss with the woman or the couple. If they want to continue freezing it, they're going to have to pay the annual fees. If they wish to discard it, we are free to discard it.
So is this whole process safe, and what are some of the serious complications associated with this process?
So the most dreaded complication of any ovarian stimulation for freezing or IVF procedure is something called as ovarian hyperstimulation syndrome, or OHSS. What happens in this is there are too many eggs which are being formed. The eggs secrete hormones which cause multi-system abnormalities like accumulation of fluid in the lungs, in the abdomen, reduced renal function, so urine functioning reduces, and it can basically cause very severe complications, landing up even in the ICU. So thankfully, now with the advent of newer, very, very excellent recombinant drugs, the incidence of OHSS has gone down drastically in the past few years. And presently, I run an OHSS-free clinic. So I have not seen a severe OHSS long past. We use agonist trigger, use antagonist stimulation in women who we are afraid are going to grow too many eggs and may be at risk of OHSS. And we give them protein supplements and make sure that at every step we're watching out for this to prevent this from happening. Apart from OHSS, there are no major severe complications. There is no increased risk of any cancer, premature menopause, or any other long term side effects. Whatever is there usually comes down once the woman has her next menstrual period, and then she will be back to normal.
So, are you seeing any healthcare professionals or medical professionals who are going in for more of egg freezing options? And
Yes, I think definitely. As we all know, healthcare professionals or people working in our field are people who end up studying till their mid to late 30s, even sometimes. And apart from this cohort, you have a lot of young working women who end up finishing their education, wanting to opt for higher studies, wanting to maybe move abroad, couples who are yet unsure about their decision whether to have a child, when to have a child. So these are all people who are interested to know about what exactly egg freezing is, what it entails, and they are coming forward. The awareness has expanded drastically, and I am so happy to say that now per month I'm doing about 2 or 3 cycles of egg freezing itself, which was barely anything a couple of years back. So thankfully, because of the increasing awareness, healthcare workers and other women are coming forward. They are lucky enough to have work in companies where insurance providers are also compensating for the cost of egg freezing nowadays, and it is giving them an autonomy over their reproduction, which was not there in the past. So it's really great that things are changing for the better.
thank you so much. We've had a very insightful and informative discussion today, and I'm glad that we spoke on so many different topics and probably help in raising some more awareness in this.
Thank you. Thank you so much, Nishad. Thanks for having me.
Thank you for watching this video. Subscribe to our channel and follow us on Instagram.